another one that you're like, oh my goodness, and you're unfortunately, this is something that's coming on employers. We don't know exactly. In theory, this is one I think could get delayed a little bit because in theory, this is due at the beginning of, like the end of this year, and then moving forward, they're going to have these due in June or by June, it says. But this is something where the federal government actually has to get the information in. Again, that comp disclosure stuff, that like that, I mean, I don't know how you're going to report that. Like there may be like a 1-800 number. Is it something you do online? They're going to get that information in. So that may get delayed again, also a little bit, just because the federal government has to build something to get the information in. So this is one where they have to build something to take in the information. So this possibly could get delayed, but it's in the law, it's coming and it is important. So what it is, and it also could also get another where they could probably, if they were going to change something with this, is this applies to all groups, regardless of their size, everyone. And they may put some type of like size limitation on it, possibly, because again, it's a lot of information for everyone to do, and this is a requirement direct on the employer. And so, like, for example, we have to do W-2 reporting on the cost of coverage on W-2s now, but for the last 10 years, they've said, well, people that issue less than 250 W-2s don't have to do it. So I could see them, I'm not saying that that's the number they're going to pick or the threshold. I'm just saying it's possible they may like come up with some type of arbitrary standard to say, well, we're going to transition this in for certain size groups, or we're going to delay enforcing this to build the system to get it in. But, much like employer reporting, it was delayed a little bit, but then you had to do it. W-2 reporting, yes, some people still don't have to do it, but others have to do it. So it is coming. So, and this is something the employer is going to have to report. Kind of like, I'd say probably the most relatable thing would be the 5,500, because you don't have to give anything to your employees like you do with employer reporting. You're going to have to submit something into the federal government. So probably if you file a 5,500 or familiar with that process, my guess is that they're going to build off of that or something similar. So, but the employer has to take data. This is data they do not have. They have to get it from their PBM and from their claims provider. And also, if you're worried about like, how in the world are we going to make them give us this data? What if they just say no? The law says they have to give it to you. So like there is protections on you to get the data to get there. You're going to have to report your plan year, your number of enrollees, where you offer coverage, and like some demographics about your company. And then you're going to have to give information about the the specific to your plan, the 50 most common prescribed drugs to your enrollees, and how much you paid for claims for all of those drugs, the most expensive, 50 most expensive. And if you're like, I have 30 employees, I don't know if we all, like, how many drugs do we take or how much overlap? Yeah, I know. But but if you have a big plan, this is going to be very evocative, right? And how much you have to pay for it. And then some other information about your drug claims, including the rebates and other things about the drug claims. And then also your other, to compare it to other claim spending for your plan. So it's not just your drug costs. You're going to have to say about other things for hospital costs, primary care, like different types of costs. And then the amount, we have to say what the premiums are paid by employers, employees, and how that affects it with drug rebates and fees and things like that, and other things about drug costs. So again, this is not data that you are going to be able to pull together yourself. You are going to have to get it from your carrier working with the PBM, or your TPA working with the PBM, but then they layer on stuff that's specific to you. So they're going to have to give it back to you and file it, or it's possible that they will come up with a mechanism like, a lot of TPAs might do your 5,500 filing for you, or other vendors may get all this information and do your filing for you. It's very possible that you are going to contract with a third-party vendor to take care of all of this for you, but it's just something that you're going to have to worry about. Like, much like you probably don't do your employer reporting yourself, you probably are going to have to contract with someone, and that person's going to have to work with you to get all this data together. So this is coming up. It's supposed to start next year at the beginning of the year. I don't think they've built the system. They have not built the rules. Like, no one knows what the form is going to look like yet, or how it's going to set in. So this is one that's probably going to be delayed, but maybe not. I mean, they already have a 5,500. They may be like, we can whip together a form, what exact deadlines, like 5,500, there are penalties for not doing it. I'm going to say it's going to probably be like any other filing. If you don't file your taxes, like the 5,500s, like those penalties are kind of set in the code. So it's going to draw from that penalty structure. So it will be significant if you don't do it or you do it late. That is all going to be specified out in rule later this summer. But this is a big one to get information out there. And you might be like, what are they going to do with all of this information? Because this is actually rolling into the federal government. This is going to generate reports and things like that, and inform policy making moving forward.
That's incredible. You mentioned that it's regardless of size.
Yes.
Does that, I'm assuming that it doesn't matter if you're self-funded or fully insured, it's just everybody.
Everybody, every health plan. So like if you have a group of 2, and you might be like, I can tell you all the drugs we take because it's me and my
Top
business
50.
partner. And like, we just go up to the medicine cabinet and blah, blah, blah. Doesn't matter. Still have to do it.
That's interesting. A takeaway that Mike and I were talking about is, one, if you're self-funded, you're getting this information already from the Connor team and from the Total Control team. So some of those things you're looking at are like, well, that's just our like annual report. Just send it along. And I think there's going to be a component of that a lot of this information it's simply taking it from what you're already getting from a PBM, maybe tweaked a little bit and then submitted to the federal government. But I think the opportunity here is this, a lot of employers, I'm sure some on this call, always get told from us, unfortunately, but we're just relaying it from the insurance company is, you're not big enough. I don't have to share that information with you. And now they do. So the value that some of the larger employers have had because they have access to data and they can take more control and make strategic decisions with it, that's going to roll downstream with this reporting requirement. So we think that there could be some significant opportunity here for smaller employers, and we're very interested to see how that plays out. So we are now going to move in to the lightning round.
Okay, before
lightning round.
One thing about this, Ben, that I forgot.
Sure.
I do want to say though, for these smaller groups, with great gifts come great responsibilities. So one thing that we are going to have to be cautious about, and I think that we are going to be hoping for and pushing for with rules of all about this, is some type of protections, because you are getting this data. It is de-identified, but depending on how small you go down, you do have vulnerability relative to charges of discrimination and things like that. And so I think in protections for employers, and then also thinking about from an HR perspective about using that responsibly, we just, because again, even though it's de-identified, the smaller you go, the more likely you are to be able to identify and know who it is. And so that's just something that employers are going to want to be cognizant of. And if you're self-funded and getting this data already, you probably have already thought about that. But I just wanted to kind of put that out there. And we don't know, but with some of the ACA stuff, like for example, in the small group market, you used to have blended rates. And now you have age rating and everybody, knows what each person on the plan costs specifically. And employers are very worried and said, well, what if someone gets at me for discrimination? I'm just, I'm charging what I have. And now I know. And they made it very clear, well, that's not discriminatory. You're just following the law. But, you just have to be kind of aware that when information's out there, people might might complain. And so a policy and thinking about that ahead of time is a good thing.
Yeah, I agree. Proper controls is so important. And, I think in a lot of our relationships, and I'm sure I can speak on behalf of Mike too, that's why you need a consultant you can really trust. So as they're looking at that data on your behalf as a business leader, because some of that individualized data you don't want to see, you got to have strong confidence in your HR leader as well as your consultant to really put a strong plan in place when it comes to that individualized data so that that person's protected, but you also can drive the business forward with strategy. No
Definitely.
question.